Sharon. Are we sharing okay? Okay, good.
Yeah.
All right.
Yes, yeah, everybody can see it, no problem.
We are in the heart of August here, which is really hard for me to believe. How about you guys? I must be odd, and it's hard to believe it's August. I did see some scary pictures today. I don't know about any of you, but of kids returning to school. I don't know if it was in Massachusetts or another state. I assume it was another state. No masks, and the hall. This was on NECN. The hall was packed with kids. So hopefully we're doing a better job here, and also helping folks get educated about how to be careful, and because I think I keep hearing those are the key things: washing our hands regularly. We do have a site that we've posted and advertised, and we can do that again, about trying to help folks with disabilities as well. There's videos that people show, the safety practices. There's pictures, photographs, but it's so important for all of us to do that. And since the numbers have gone up, so let's do a little looking. We're back to the traditional thing, and I'm going to close this up a little bit so I don't have trouble seeing my own PowerPoint. Numbers of people tested rose, and this is looking at last week, obviously. 9,000 higher than the week before. We're approaching 1,300,000 people. And then the total number of cases, though, rose by 2,066. That's two weeks in a row that the cases have rose instead of going down. And last week it was 1,890. But as you recall, last week, I thought I had an extra day in there somehow by accident. And the number of people who died rose by 99 to 8,488. That's 110 compared to last week. So it's fewer than, last week in terms of deaths. And, I don't know if that means the cases are less complicated or it's just a matter of timing. And so that's not great statistics for us. We know we have 5 to 6 homes in quarantine. We were informed last Wednesday by folks at DDS, and there was no deaths in the last week in congregate housing, but 20 cases reported. And that's in a situation where 1,211 people have recovered from COVID. We were scoring, we're still at about 16% of people living in congregate care homes. It's a little less percentage on the state operated side. I think it's closer to 15% there. Of course, we had half the people get sick at Hogan Center. And again, larger settings. In New York City, there was that setting around Long Island where everyone got ill in a private setting that had 50 people living there. So I think the bigger the place is, the more issues you're going to have. And of course, we don't have testing on demand yet. We do have testing is being worked on for, you can still have the mobile testing. So that's really good. The bad news there is if a staff person's suddenly off duty, sometimes the timing of getting them there for the mobile test is an issue. However, CVS and other places are requiring testing. And, so that's the good news. And in terms of day programs, some more continue to open, though others are not opening until September. So, Kerry, you hosted last week a focus group, or the week before, but I think it was last week, actually, on Tuesday. And some of the feedback, we got a lot of it, wasn't great feedback. There was some good feedback in the sense of quick response on PCA applications, quick turnarounds. And I assume that was both for, extending hours, eligibility, and for new workers, because it didn't discriminate among type of requests and applications. In the middle of all this, of course, I get to hear about a colleague of mine who works somewhere else who reported to me that even though the PCM, which is the PCA manager, we recommended certain extra hours, I think maybe 4 or 3. The folks that manage this, I think it's Optum, actually cut her daughter by 2 hours a week. So how that swing went from 3 or 4 hours extra to backwards 2 hours, I don't know. They pretty much blew off her application for appeal. And so that's, of course, one example, but it is concerning to me. And so we're trying to pull together some feedback for HHS and DDS, because I'm sure if they heard all this, they would not be thrilled. And if you recall, a few weeks ago, when Whitney Moyer was with us, and she did a great job presenting, she did say that the hours hadn't gone up since the crisis, and you would expected the hours to go up, right? If people are using PCA to take the place of day programs and things. So here's the feedback families did not hear initially about increased hours option. You know, the whole automatic thing. The home health was not helpful. Kerry, you want to add to that? Like, I'm assuming part of that was it meant strangers coming in the house. I'm not sure.
Right.
Right? Did they?
Yeah. So they, people, they couldn't find a PCA could opt out and use home health aides and in substitution. But again, it's inviting people into your home who are strangers and don't know your kids. So was that helpful in the long run? Not really.
And also with home health, sometimes you may get John Smith on day 1 and Mary Carter on day 2, right? So
exactly, yeah. It's not real consistent.
And so for many, the increase in hours.
Hello, Leo.
Excuse me?
Who is this a guest speaker today?
You guys are going to be the guest speaker today. So if you could hold off, Jared, we're going to have a dialogue today about advocacy. Okay? And really looking at the long run, what we really need to do, which I probably should emphasize, which we'll talk about in a few minutes, okay? On top of that, the increased hours were the same as school vacation. So 2 of my colleagues got pretty minimal hours for that. They didn't really make up for the loss of school. So we're talking about 3 hours a week, potentially. And these are both people that need help. One with a number of areas of assistance for daily living. When I say daily living, it means maybe help in the bathroom, taking a shower, preparing and eating meals. So you would think minimum an hour and a half a day, right? You would think 5 days a week. That would be the minimum. I could see if someone, needs help with activities of daily living. So, and I already mentioned the PCA applications did have quick turnarounds. We mentioned earlier, Kerry noted that some families didn't want outside people in the home. And then the recap there about what we just said about PCA and home health aides. So a lot of it, these were sort of family feedback, not provider feedback in terms of the dilemmas faced. Some more feedback. Oops, sorry, hold on. Getting ahead of myself. Nursing agencies did not have PPE. Some families provided significant amounts. So those people getting what I call block nursing, which is, for folks with complex medical conditions, you have a nurse or a couple of nurses assigned to help you with your son or daughters. Maybe it's a G-tube, maybe it's other medical instruments and of course medical care. So anyway, that was a big deal. Glove supplies are 50% less available, so people are still experiencing that kind of problem, especially families. I think agencies are spending whatever they have to spend to get the PPE. Nursing overtime stopped after July 31st, so that was a big deal. So that means back to multiple nurses in the home. And then some families are talking about they'd love to have more individualized choices rather than day habilitation in terms of the group and the larger group. And probably I should have had this one moved up. Poor communication from CCM, community case management. Those are the folks that are tied into the nursing and other services for folks that have complex medical needs. There was no system to notify if a nurse contracted COVID. So that's a bunch of the feedback we got. The big deal, the reason today's dialogue is so important together, and um, is that we've got a lot of factors here that this uncertainty means actually, and there's an arrow on the chart, that we need increased advocacy. And I can't emphasize it enough because we have these factors sort of working against us. There's the present deficit. There's the unresolved Washington negotiations, despite good news. We received, last week, the things we were getting a little further on state funding, but the home and community-based services funding is by no means clear. There's mixed messages continue from the White House. We have an unknown impact of a second surge. So we know that people are thinking end of October, November, maybe a second surge. Our public systems are stressed. So forget about like our world and our system. There's the systems around us, whether you're talking about education or you're talking about hospitals and police, and they're all feeling stressed. They might be taking a deep breath right now, but the school systems aren't. They're trying to figure out how to serve students. And and I know every city in town is thinking about that. It's become the major focus in addition to fire and police. And then private businesses are reeling, right? From financial issues. Transportation at best is unclear. I know that, for example, some agencies that are residential agencies are refusing to transport. Well, they're probably not funded for it, but that means the human services system that's there that goes through regional transportation agencies, they have to do the transporting for people who do want to get back to group settings. And add to the whole wider world in terms of perhaps a lack of empathy for us is parents of children and youth are overwhelmed with school routine changes. So you have the typical kids and what that's causing for families. Sometimes that results in lower empathy for us, and what we're facing as a community of persons with disabilities and family members. So we have to increase our advocacy, our voice. If we don't, we can easily get inequitable treatment during these times. And we know it's going to be a challenging time. We just know, and for example, the day program piece is still in play for August, September, October, November. July is almost finalized. So that means some people have been providing services, community-based day supports, or trying to start services that have no idea what money or retainer funding they'll get for July to be able to provide it in August and the fall. And then, of course, congregate care homes, the group homes, have not gotten any funding for July for the staffing that have been working during the day in the homes. So we have to really go the distance, in our advocacy. It's going backwards, or if we don't go the distance, we're going to be facing some serious problems. So number one, if nobody else is proactive, our world's got to be proactive, right? And I just explained to you that there's people been working during the day at homes. They're not supported. Our family members. I think there's only, we're going to talk about families and sort of what we have to face. But we do think all individuals who had received services need to have some kind of option. And just to be clear, program option, if that's possible, if it makes sense. We don't expect, like if someone's got significant medical issue, maybe uses a nebulizer, going in the first week the day program is open probably isn't a great idea. However, that might be the same family where the parents got to work during the day. So that might have to be in some cases. So we know that those are the things. In terms of the in-home option, there's only going to be some physical in-home if people want it. Why is that? Because I shared with you the budgets. I think it was last week where I got into the more personal budgets and how difficult the ratio piece is. At the most. Maybe you're talking about the equivalent of one visit a week. And if you spread it out during the week, you're going to be faced with transportation, travel time for those same staff. So it's probably not going to make sense. You're really talking about once and most twice a week. And some people are doing that. Some agencies are doing in-home. And then in-home is also what we call the remote virtual to fill the gaps. And hopefully, agencies will get better at that. But if you're someone who's got a condition, where he or she needs someone else to help you pay attention to the virtual, that's adding another layer of work for the family at home. Turning 22, got a real issue there in terms of addressing the turning 22 folks that are coming out. Some people are being offered homes. Some people are transitioning. Other people are not. We heard from someone who's been waiting 5 months, 6 months. And that probably makes sense because of COVID starting in March. So that's a piece where even during the day or program option is tough at best to figure out. So this is some of the communication we'll be having with the government, with the administration, in terms of how do we look ahead now, be proactive in these areas, and then a bridge to the future that is person-centered. I think this again reinforces, we've had some sessions on self-direction, and we'd really like to see more of that happen. You offer 24 hours a day, 7 days a week when needed, but even, we need to think about other possibilities which leverage community resources. And I think Giassi had talked about that on another one of the webinars I had done last week on the state of the state for the Arc of Plymouth and the Upper Cape, where they wanted more of a state of the state presentation, and we offered that. And that's going to be, I think, really the future. Not for everybody, but people should know about it. People should know about self-direction and make self-direction easy. Don't complicate. Some people may want to run everything themselves. That's great. There's opportunities to do that today. And then offer other options that are personalized as a choice against a full day program, even if not full day. And that's a tough one, right? Because folks that are working still, who have a loved one at home, the full day might have to be because that's what works for them. But for people that don't need supervision all the time, who can be an independent part of the day, there's some great possibilities when you develop self-direction. And then technology, remote technology. We hope to be talking about some new apps in the future, but there's technology that's far advanced in other states that we're working with the DDS and HHS and ADDP, the trade organization, on a task force around technology. We hope to, in a few months, have the report ready for a 3-year plan. We'd love to make it a 2-year plan, but we don't think, the work we put into it makes sense. And given the COVID situation. And then finally, charting the life course. It's a wonderful person-centered tool, and the Kerry's presented on this, Margaret Van Gelder and others. And I just think it's something some of our chapters and non-chapters have been really taking on to help people think about their futures, their life, and also to balance the family's life, especially when you consider 72% of people with intellectual and developmental disabilities live with family. So you want to be charting everyone's life course, right? And thinking about each generation. So let me do this at the end. I think what we've really got to think about together is this piece, this kind of, I want to give you a few more statistics that aren't on the chart that I just shared with the task force this morning. Basically, our resources, not including Mass Health, the Department of Health Services has approximately a $2 billion budget these days. 76% of it, or 75.9% if you include institutions, are for residential services. 3%, give or take, 3.4% are for family support, which has been growing over the last few years. So you can imagine what it was before as a percentage. And between 11 and 12% is in day and employment programs. So the 24/7 piece needed for many, right? Not when I say many, it's a subset of our constituents. You can't walk away from that. That's going to be a need for forever. But what can we do in terms of leveraging and thinking more about other options? And that's something going on, but we have to plan for it. But in the meantime, in this sort of deficit universe that we're in, we also need to advocate to keep the money we do have in the budget So I will be pulling up a chart to you as well in a minute. But I should do that in a minute. So it's ready, but let me first take you to our website again. And many of you have already done this. You've sent emails to your officials. We also have the ability to do email to phone. So like texting the officials, I want to really encourage people to use that option. We can also communicate with you by text. So you could literally be doing something and in real time share a campaign request in less than 3 minutes with your phone, not even have to open your computer. I do encourage, when you do text though, to make sure the legislators know your story. And, but we think the don't cut us out, hashtag don't cut us out, is more important than ever because of, the reasons, I just shared with you a few minutes ago. And I also want to show you, I'm going to stop sharing for a second so I can pull open a file and share with you the budget sheet that we've shared with the legislature. It's a budget sheet you may have seen some time ago. I'm going to just pull it up and share with you today as well. But it's something, only a handful would ever remember because it's so long. It's like ancient history now in terms of having this information to you. Okay, here it is. And I'm going to just share the screen again. And oh my God, I just opened up 2011. It's sort of embarrassing. Fact sheet by accident. Okay, here it is now. Let me get it open to you and share the screen. That was sort of weird. That's what happens when you have too much memory in your computer. Let me get it open. Here it is. Okay. Do you see it? So here is, we updated it, and you'll see something different about this fact sheet. The original one was all about the workforce and had these line items in the back. Obviously, because of COVID, we had to change, right, and protect the budget. and all the line items, are unlisted, but obviously we wanted to maintain the state budget. And so this picks up on the Governor's House 1 original proposal. We're asking him to maintain the entire proposal. And it included expansion of family support and respite. It included expansion of the autism omnibus by $8 million. It included, whole, I'd say probably the line item we were most worried about was residential, but it had grown so much in 2020 that we figured we'd worry about it during the fiscal year if we started to get calls from people who were transitioning, turning 22 from year 1 to year 2. So, and then we do mention, of course, the workforce again, because the $125 million had been estimated for DDS for the residential services workforce. And, basically, this is something we should have posted, but we can also send this to you as part of the outreach today and for you to share with your legislators, because I think last week we were approached. Maura Sullivan had told me that they were starting to work. They approved a 3-month budget, as you know, and they were looking at the full budget. And one of the lead legislators has said they're trying to avoid cutting our budget, and hopefully that's going to be the case, and that would be huge. Just to have that happen would be huge. And then, of course, all bets are off as we go into 2022. But normally in the process, we would have been working on these kinds of things. So I want to open it up now and reach out to you and have a discussion about this. Just that we've been advocating, everyone's been advocating, which we really appreciate. And want to also look at the chat. So Kerry's going to help me to start with what people have given input so far. So Alice, thank you. Alice says 9 positive cases from that school in Georgia. So that was the one, 10% mask compliance rating among students. Yeah, that's exactly. And then Cheryl um, was told that your son's PCA increased in hours, you were paying, ran out of hours. And I've told the staff that was shorted pay. Wow. Cheryl, thank you. That's terrible. So that's kind of example that we have a meeting this week on the phone to take our focus group feedback, but also to get more feedback. And we're going to be meeting with the commissioner and 3 people in DDS that, including Margaret Van Gelder, that, you know, play a role in terms of family and family outreach. And then we will we'll need to involve Mass Health in this as well. But we're really glad to be approaching the issue in a way where we can get further feedback of what's going to help during this extended period, because some families will not want anyone in the house if the pandemic surges again. But Carrie, let's open it up and for a dialogue. And you know, what does the ARC need to do to up? Do you have suggestions for us in terms of getting even higher engagement than we had in the past months? So people will be contacting their legislators and making sure we're not left behind. And obviously, the PPE for individuals and families to have folks come in their home and the day programs is really essential.
I guess, Leo? Oh, sorry. Leo?
Yes, is this Giassi?
Yes,
Go.
hi. Just what I'm wondering is if we were to advocate for this budget, would that help address the concerns raised in the focus groups, or are there other things we need to advocate for?
So yeah, there are other things. Thank you for asking the question. I think this would be an important start because they probably haven't spent all the funding, right? Because there's been retainer payments in day programs. They've spent more money in residential perhaps than they had planned to, right? So for example, $44 million, but part of that money was for other state agencies as well, wasn't all DDS dollars. There's probably savings in turning 22 right now, which was budgeted 25 million, right? Mm-hmm. So let alone the annualization for people from last year to this year. But we'll also have to advocate in terms of Mass Health, because as we shared, as we heard, the hours in PCA has been flat, which, you know, to me reflects using less PCA, you know, or the same and not more, right? Mm-hmm. The other piece, I mean, and I know, Kerry, what we heard is people that didn't want people in home were at least hoping for funding themselves, even if guardians, because they were doing the work, and that would help them.
Exactly. I mean, all the personal care was being done, but just not by a outside PCA. It was the caregiver who was doing it, but unable to be paid.
So, and then reasonable stipends, additional stipends for people doing 24/7, which has not happened, you know. One of my colleagues, Nonotuck, George Fleishner, had said they made sure their individuals got PPE. The people that, even though they're independent contractors in the AFC program, because they felt like they really needed to worry about the people in the homes, and they made that commitment to deliver that. And I know others have done that. Some have not been able to do that because of budget issues. But I'm concerned that not enough people realize that their voice can make a difference. I'm really concerned about that and how we can engage more people in terms of both, not just the side of day and residential funding, but also for families in home. And what should we be advocating? I mean, for people who don't want people in their home, fixing the Mass Health problem with hourly rate or whatever isn't going to solve that. We can offer, try to get stipends for families at home, even if you can't get them PCA money. But let's say we did that, and what if they're burnt out? What if they do need help at home? I just get worried that doesn't solve the problem too. But anybody else? Oh,
right. Judy had a comment. Can you update us on Mass Health and day program start dates and virtual hybrid and on-site Mass Health guidance?
Sure. So I can pull up an example of the guidance, and let me pull it up first, and then I'll switch. I got to go to COVID country here. So there's a 28-page guidance that's both for DDS and Mass Health, but there has not been anything in writing that has come out, unfortunately, since then. And I guess I got to look in here. I'm in the wrong file. I got to be careful that I open up something I'm allowed to open here. Okay, July 29th. There's a 28-page guidance. I'm looking at the draft. I don't know if this is a community access guidelines. No, it isn't. Okay, sorry. I just sent it to, I don't know why I can't find it. I sent it to a few people the other day. The one I have is a draft. But so I cannot show you it. It says draft on it. Let me see if this one's the new one. No. Okay. So I'm sorry I can't show it to you. But the bottom line is 28 pages. It's long. It was released on July 2nd, which, now is more than 4 weeks ago. And that basically told day programs what they had to do. One element of the day program, which I'm glad Judy asked the question, that is no longer needed, is basically says that families and individuals have to acknowledge the risk of returning to the day program. In other words, they're going to be with a group of people. So I just want to be really clear. That form, whether it was announced last week or will be announced today or tomorrow, no longer has to be signed. That's off the table, which makes sense to me. It also put providers in the position of having to do this form, which, was really a state mandate. So anyway, leave it at that. But back to the programs. I can't give you an exact reopening schedule because agencies are all reopening on different dates. So for example, when we had Chris on and his colleague, that was a few weeks ago, they had been one of a handful that had opened, 27 at that point, or 25 of 170 or so day habilitation programs that also opened. And every week, new ones were planning to open. But we do have the issue of the space, right? You have to have 133 square feet around an individual, and that's a safeguard. That's good. People have to wear masks if they can. 133 square feet includes staff, so you may only be able to fit 40% or 45% of the people you used to serve. So what people are doing, and this is pretty current, is they're trying to get everyone in at least part of the week that wants to come in. Okay, that's really important. At one agency, that might not be an issue because maybe a minority of people want to come back. So you can satisfy everyone and fit everyone, right? There's a funding, so that's the space issue. The second issue is the transportation issue. And some agencies have the resources to actually pick up people for their day programs, even though they did not provide transportation to even some people. So that's being done. And that's a lucky agency that can do that. And probably it's a multi-service agency that does more than day programs and employment. But some day and employment programs have their own transportation. And I think those that do, they would have figured out a way to do both. But they may also be delayed in opening because they're trying to figure it all out. They're trying to figure out the day's program site, and they're trying to figure out the driving, and they're trying to figure out the employment for people. Now, and people, by the way, some jobs haven't reopened, some jobs have opened. So that's, I think, to be what I'm hearing the most that's being offered is a combination of in person for people who want to come in, right? If they don't want to come in, obviously that's not on the table. No one's being required to come in, by the way, or risking discharge or anything like that. Let's be really clear. Secondly, in person, which is not going to be every day. I can't emphasize that enough. If you're funding, we're happy to do the funding thing again, and you can see the recording of it. I think it was last week, Kerry, right, where we talked about the day we used as an example. But community-based day services are better funded than day halves. But again, they can't afford, it's based on a certain ratio of people. They can't afford to send one-on-one five days a week, let alone 2 days a week, okay? So you have that, and then you have the hybrid as the piece that's probably going to be the most often used. Okay, and then Jean, you want to comment on Jean's text chat?
Yes. So Jean was saying that it's hard to find PCAs, and a stipend might help, and that they'd be able to pay a family member or a friend to help out occasionally, and who would like to help out but doesn't want to go through the PCA employment process. It would provide us with some flexibility when PCAs aren't available.
Well, thank you for that feedback. So, because we are trying to figure out, you know, we know big picture what we need to advocate for, but what's really going to help, right? What's going to be, yeah. So thank you, Jean, for that feedback.
And Jarrett raised his hand. Jarrett, do you want to unmute yourself and ask a question? Okay, yeah, can you unmute yourself, Jarrett? I'm trying to unmute you. I can't. Anyways, okay, we can come back to you. Oh, there you go. Did you want to ask a question, Jarrett?
No.
No, okay, all righty. Okay, and then Diane was saying that as individuals remain at home, are they at risk of losing their placements,
No,
either in residential or in day hab?
No, I think the clear thing is to communicate with your provider. I think people were worried that was the case. I think that was a misunderstanding. I think if someone's like not planning to come back until the vaccine is available, and I don't know if anyone's on the call who's at that place, I think at that point, there might be, you know, I don't know if we'd even call it a temporary discharge, but it shouldn't be just, you know, a clean discharge. It should also include referral to, you know, what are the supports that would work. I mean, that's why we want to go the direction of more person-centered, more self-direction, and we've been encouraging that as this COVID virus crisis increased. But no, I'd say if you're not ready yet, you're nervous, you want to see how it goes, not at all. You're not going to be at risk of being discharged. There was a fear of that. There was some hubbub about a week or so ago. I mean, I can't keep track of time anymore, but we were telling people, agencies were giving communication that we thought was incorrect, and that was resolved pretty quickly, or within a day. And then Liz is saying, what's that? You want to?
Yeah, this is a great idea. Lots of college students are taking a gap year. Could this population be a source for extra income help, maybe with stipends or in community service components?
Awesome idea.
Yeah, that is a great idea.
Yeah, because they ain't traveling, that's for sure, right? During the gap year, that's not happening.
Right.
Great. You
How
know,
about anybody else?
I can tell you what's happening with agencies too, for those of you that either have someone in a residential setting or, you know, even, anyway, what I've been hearing a lot of is they're still struggling with enough employees, and some agencies aren't recruiting because they're so concerned about the financial implications of their agency. So in a sense, this advocacy, the reason our advocacy is so important together is we need to free up some dollars so people don't hold off from recruiting during this crisis. So, well, yeah, the HCBS, we just had an alert from national, you know, of course, our senators are on board, and I made sure last week, you know, to get to Senator Markey and Senator Warren. Both of them have been incredibly supportive in this crisis, and Senator Warren had helped lead an authorship of a letter 8 weeks ago about embracing the House version. So that continues. So I say if people could write to Senator Markey and Warren and thank them, the leadership would say, could you please continue advocating? We're very concerned that HCBS get incorporated. And HCBS is the way our community programs get reimbursement to the state. So it's another way to help the state budget. It's 50 cents on a dollar for the dollars that qualify. So it is a really important, and there's an action alert that we can make sure we put out again this week for people to follow up with, but it's out there, and we've asked people to participate. Okay, so
Cheryl did have a statement that she knows that some members of DAHABs don't have access to an iPad or internet to access the remote learning aspect. I mean, I know that lots of family sports centers and DDS have been very, very helpful this past spring and early summer in getting people access. Also, some day programs were able to provide equipment and access to hotspots and things like that. So I don't know if you have any other things to add, Leo.
I want to really encourage people, Cheryl, if you know people in that situation, please have them call their family support center or the area office. And family support center may not have the funds right now, but Kerry's joining me in the meeting this week, and we'll be talking about this and other things. And so I really encourage, maybe Kerry, it's even better to directly call the area office. And if they don't have a service coordinator, to call the associate area director and just say, we really need, an iPad, or we need access to the internet. I also want to encourage, Kerry, whose email could we use as a CC if people email this request? And I realize some people, they don't have access to the internet, they can't copy us. But if we also had a sense of how many people, or if there's a local advocate that's willing to help people as well, just to encourage and get the information about, because it'd be great to know, is this like 2,000 people across the state? I know it's not just a few hundred, right, that probably don't have access, because there's the issue of affording the access. And so it would be helpful for people to call their area office, I'd say, as a first step, since we don't know how much money the family sports centers have right now to dole out right at the present moment.
Sure. Okay, and Marin was saying that, there's some individuals who really aren't a good candidate to return to day programs, but how can they can get their PTOT speech? Can it be provided at home in a group residence?
Yeah, let's put that on the table. What the status is. That came up, I think, a week ago from Diane. We need to, let's get on top of that at the meeting as well. And obviously that crosses over, but it's also relevant for families. And so let's get some help on that. Thank you for raising that issue. And we'll make that a specific ask as well. And then access to the internet. And more people still need.
And then Leo, about the equipment, not having equipment, I mean, wouldn't the DAHABs be able to report out how many people can't participate because they don't have equipment?
That's a great individuals. And we don't know what they're doing. So question one is, what are DAHABs doing, right, in delivering allied health therapies? And then two, shouldn't they be documenting who doesn't have access,
Right.
See, this really works. This is what's called, this is really good stuff. And, we're organizing it probably individually. We've heard some of this before, but now we're at phase 2. We can look at the past notes, but it's really good to get the current, what people really, the key issues, that people are experiencing. So thank you for the input. This is how it's done. And sometimes it's as basic as making sure, like, some areas are less responsive than others. Any last things? It's 12:46. I already went overboard. So, and think about, we've got to go the distance. If you have any ideas about our advocacy and what we can do, people are in need. We've got to be responsive. We can't go backwards. So thank you. Thanks for all you guys are doing in this fight. And, really appreciate the communication and the connection. So, Kerry, I don't know if you want to say any last, what's tomorrow? Kerry, by the way, any?
Tomorrow we have Meredith Pizzi from Roman Music Therapy, and she's going to talk about, just the value of music therapy during these COVID stressful times, and also how to access remotely a lot of music therapy groups that she
What
does.
date we're meeting tomorrow?
That's tomorrow at 11, Jarrett.
And Maura is also taking a break on Thursday again, so just to remind people. But tomorrow at 11, you can be on with Carrie, and it sounds great. Music therapy, that's awesome. It's a great idea. And thank you, Alice and Christine.
Who is the speaker?
Her name is Meredith Pizzi, and she's the executive director of Roman Music Therapy.
So everybody have a good week. And
thanks for joining us.
Didn't get to say hi to you. Have a great week. All right. Great seeing you guys. Great seeing everybody.
Thank you, as always.
God bless.
Great job.
Take care.
Harry, can you send me the